Talking about kidneys, I would be careful with overdosing the red on kidneys, because even so, we are only supposed to support the kidneys and help them. Red can overstimulate kidneys in this day and age. Would you agree? We are overstimulated already. We are running on the empty already. And kidney energy is the energy in the body, acupuncture-wise, that we need to be very, very careful with. Because we don't want to overstimulate, even when the treatment calls for red. So for example, we're talking about kidney pulse. And in most manuals of Colourpuncture, kidney pulse, in most of them, kidney pulse are indicated red. I would palpate, because normally when you check kidney pulse, one side is extremely sensitive and another one is so. So I would use red and green. I will start with green on sensitive point, and then I will start with red, because this way you're still supporting kidneys with red, but you're not abusing the energy. You're still giving green to support and balance. Same for kidney one. Kidney one is, in some manuals it is red, but I will always also go for red and green. So this is the only exception when you do need to be extra careful, even when the manual says this is red. Colourpuncture was created in 70s, last century, when people generally were a bit healthier, more robust, less informationally distracted and burdened by everything which is happening now. Then maybe this was a good thing to do. Now people are so exhausted, and this is a really fine line. This is really presents difficulty, because yes, we all need support cheap, but we also need really support our parasympathetic system. We really need to support relaxation, because this is a much bigger problem now. We need to support parasympathetic system with our therapeutic means, but also with coaching, because people sometimes don't understand how important this is. Because if you think about it, habitually, they read the news, habitually, they take on extra shifted work without realizing how harmful it is in the long term. Or indeed in the short term, a situation like last couple of years. Classic sympathetic dominance is a big problem. Lots of people ending up with severe consequences just because it wasn't managed properly. And the problem is, this is not a common knowledge. This is why you need to really coach patients who don't have medical or biological education.